It is Tuesday, December 1st, believe it or not. We're heading toward the end of the year. This is our 55th episode of the Kahnawà COVID-19 Task Force Updates. And on today's program, we have three guests. Lisa Westaway will be here. And we'll have a new guest joining us from the Kahnawà Education Center. But we'd like to start things off with a member of the COVID-19 Task Force, Arnold Lazare. Arnold.
Good evening, Kahnawà. I'd like to start just by offering condolences to the Phillips family on the passing of their mom. I'm sure everybody knows, but Lloyd, Anne-Marie, Tanner, and Ashlyn are first responders in the community. And I think it's indicative that the task force members are all affected by everything that goes on. The task force is clearly monitoring the situation, and unfortunately the news around us is not what we were expecting. Today we're going to be looking at some of the ways that we can try and make Christmas a little more bearable. I'll defer that to Lisa. But I would like to remind the community that what we do today, our actions of today, we only see what happens in 3 weeks. So we always urge people to try and limit the contact. On a good note, the holiday train is going to be virtually here on December 12th at 8 p.m. and it's going to be broadcast on the Facebook, Twitter, and Instagram. And of course, the Cattery Food Basket is always a beneficiary of the holiday train. We are pleased to inform the community that while the actual train viewing will be virtual, the Cattery Food Bank will be setting up a drop-off time from 4:30 to 7:30 at the Knights of Columbus. And at that time, we encourage people to drop off non-perishable commodities and, of course, cash. The goods will be properly sanitized and put on the side to be redistributed later at an appropriate way. I'm going to keep it short, so at this point we'll turn it back over to Joe. Once again, Kahnawà, please stay safe.
Thank you very much, Arnold. And again, the holiday train has been actually in Kahnawà now for several years, and they have donated thousands of dollars. But more important, people in Kahnawà and in many cases outside of the community are also donating, because if you've been to a holiday train event, there are people from everywhere who are taking part. This year, again, it will be virtual, and you can view the concert on the CP websites and Facebook and Instagram. So there's going to be a lot more detail to come as we get closer to that. Also, a further note on that event is that Kahnawà's recycling department will be hosting a pickup as well. Just we'll give you more details as we get closer to that, but if you can't go to the pickup or the drop-off at the night of the concert, you can actually do so at your home, so that's really good. There's news out of the Kahnawà Education Center, and joining us for the first time is their communications officer. So let us welcome Jaime Dickson. Jaime?
Gwe. For those of you who don't know me, I'm Jaime Dickson, and I work as the communication officer at the Kahnawà Education Center. Today, I'm just here to give you an update on a Phase 1 report that the Education Center has released yesterday. This report contains information regarding our school reopenings in Phase 1. It also includes results from our parent and teacher surveys, which were conducted at the beginning of November. We also have some news from our Human Resources Department in regards to our staff, and some very good news. We were given some information regarding our school ventilation systems, and we're pleased to announce that all of our 3 schools have the best air quality in schools in Quebec. So this is fantastic news that we were excited to share with our community and with our parents of the students of our schools. And more details can be found in the report, which you can find on our website, which is at www.kecedu.ca, or through our links on Facebook. You can find the link to our website or to the actual survey on each of our schools' Facebook pages, and on the Education Center Facebook page. Just so everybody is aware, we are going to be releasing some calendars in the upcoming week in terms of our updated schooling ped days and whatnot coming in phase 2. And and I also have one more thing to report. It's also good news in terms of our ventilation systems. We're waiting on the installation of a UV disinfection system for each schools, and these will be installed in the coming weeks. So our air quality is going to be much better, even though it's already fantastic. And I think that is it for now. And I'll hand it back over to Joe. Nyawa for your time.
All right, good job, Jaime. And again, their air quality will be second to none. And you know, that's actually really good news, because if you've been following the news in the past several months, that's been one of the issues, especially in Quebec, because a lot of the schools are older, and that's a topic that keeps coming up, is the infrastructure and the ventilation system. So in Kahnawà, we're doing very well. Good stuff. Well, we'd like to welcome back Lisa Westaway to our podium. She has been working hard to get this next report out right to the very last second. She, of course, is a member of the COVID-19 task force. She's also the executive director of the Kahnawà Memorial Hospital Center. Lisa.
Good afternoon. I'm happy to be here. It's been a while since I've been here to give you some information. So I first want to start with some very important reminders. And why am I giving these reminders? Some of you may say this is common information. We all know this already. However, we receive many, many questions either at the testing site or to our local public health team, asking us these questions on a regular basis. So I thought it would be a good opportunity to remind you all of these particular points. So the first is about what happens when you go into the testing site to be tested. When you go into the site to be tested, you are expected to self-isolate immediately following your test. Self-isolation means that you go back to your home and you find a location within your home where you're on your own. So you don't see your spouse and you don't hang out with your children if possible. Of course, we know that there are situations where isolation is impossible if you're a single parent. And this is why we ask you to prepare in advance, to think about what you might do should you need to isolate. So we do ask that once you're tested, you self-isolate. Why do we ask this? We ask this because if you are positive, as long as you're not isolating, if you're not by yourself and avoiding all contacts, you could be transmitting the virus to another person. And we've seen this over the last weeks, where people do come in and are tested and then are not self-isolating in their home. So again, we just want to remind you, when you come in to be tested, you should go straight home after afterwards and isolate within your home and have other people take care of you. That's always fun. Have someone bring you your meals, have someone bring to you whatever you might need so that you can be on your own in your room. This is really, really important. And why are we talking about this again now? It's because we are having increased cases in the community, and we need to increase our vigilance for all the time, 24/7. So another reminder that I would like to bring to you today is about those 14 days. So many people are asking us the question, well, I've received a negative result. Does that mean that I can move about freely? In some cases, yes, it does mean you can move about freely once you receive a negative result. In other cases, no, you cannot move about freely. It's very, very difficult for us to explain which cases are which in a Facebook Live type of post, and that's why it's really important that you speak with public health when you get your result, and that you listen to what they have to tell you about whether you should move around freely or whether you should stay in isolation. So I'll give you an example of a case of a person who comes back to Kahnawà from being across the border. For whatever reason, it could be possible that someone has had to cross the border, even though we don't recommend it, and has come home and for some reason has had a COVID test. Just because you get a negative COVID test result, does not mean that you are not at risk of developing COVID-related symptoms. And that's why the Canadian Quarantine Act asks that you isolate for 14 days, because it could take up to 14 days to develop COVID-related symptoms. A negative screen or a negative test means that you're negative on the day you were tested. But please remember that you could develop symptoms up to 14 days after travel or after contact with a positive case. And for that reason, in those situations, whether you have a negative test or not, if you've had contact with a positive case or you've traveled across the border, you need to quarantine or isolate for 14 days. Now, there's a lot of confusion with the 10 days, because we hear 10 days and we hear 14 days, and they're often used in alternates. So we want to remind you about what this 10 days is all about. Now, when you are tested positive, so if you're a COVID positive case, we will ask you again to continue your isolation. So you are now going to isolate from the day your symptoms started. You have to isolate for 10 days. So this is where the 10 days comes in. So I'm going to go back again a little bit to say, if you've been in contact with a case and you've been tested, you could develop symptoms up to 14 days after your contact. But if you're a positive case, you're asked to isolate for 10 days. That changed from the beginning of the pandemic. It used to be 14, it's now 10, because what public health has seen, and INSPQ and the research and data shows us, is that after 10 days, most people are recovered from COVID-19. So it's 10 days of isolation after your symptoms appear, and there are two other conditions about being able to be released from isolation. And that's that you not have fever for 48 hours and that you have no other symptoms for the past 24 hours. The only symptoms that may be residual, that you may have left over, are loss of taste of smell or a small cough. So I'm going to repeat that because I know it's really complicated and we do get a lot of questions about it. So let's go backwards. If you've been in contact with a positive case, or if you've been tested because you fear that you have symptoms and that you may have COVID-19, you're asked to isolate immediately for 14 days. If you get a positive result, you will be asked to isolate for 10 days from the first day of your symptoms. And once those 10 days are over, public health will speak with you and evaluate and be sure that you have not had fever for 48 hours and that you have not had any other symptoms for 24 hours. And then public health will let you know that you can now roam freely without the risk of transmitting the virus to others. If you are a COVID positive case, and you have chronic illness or you're more vulnerable, you may be asked to isolate longer than 10 days. And so it's really, really important to always speak with public health, because they will be your guide. They will answer all your questions. They'll give you all the information that you need to know what you should do when. So we thank you very much for being really open and always talking with our local public health team at KMHC. I want to next talk about where we're at in Kahnawà. So we actually have 4 active positive cases in the community right now. This is maybe a shock to some of you because I haven't spoken in a while and we haven't been on the radio either, so I haven't provided those updates. However, we do have 4 active cases. 2 of those 4 cases we're able to establish where they came from, so the localized point of contact. However, in 2 of those cases, we are not able to determine where the transmission happened. So this is worrisome to us, and it tells us that we have a possibility of more cases in the community, and that our vigilance, how careful we are, how cautious we are, how we limit contacts is especially important. So we do see in the communities surrounding us, whether it be Montreal or Chateauguay or all the other communities, we do see continuous increase in number of cases, and so it makes sense that we have an increase in cases here as well. And for that reason, I don't want to sound the alarm, but I do want to be sure that we all understand the risk that we have every day and the responsibility that we have to protect our loved ones. So I'm asking you to please always consider your masking, your distance, and your hygiene at all times, even when you're gathering 2 households. So we're going to talk about those visits because we know how important they are to our mental health, our spiritual well-being, and we're not asking you to stop all contacts. We're asking you to continue to have those visits if you feel that they're required, if you want to have people in your home, but to do that safely. So the first thing I would like to do is show the graphic that was so wonderfully done by our communications team. I want to show this again. I know that we've put it up in different areas around the community. I think that we've put it in all the post office boxes as well. So we are asking you to really try your best, if you are going to have people in your home, that you do so following these recommendations. They are recommendations. We cannot police this. We cannot come into your home. We don't want to come into your home to make sure that you're following these rules. But we're giving you this information so that you can protect yourselves and your loved ones, so that you can take responsibility for the actions that you may make on a daily basis, so that you can be mindful about what you choose to do in your day-to-day life. And so again, we remind you that in order to limit contacts, even if you have another household in your home, we ask that it only be 1 household at a time, 1 household, and if possible to limit it to once a week. Why are we asking this? Because we know that by doing that, we still limit contacts. We know that we have a better chance when we only have 1 household within our home. We know that it's easier to keep our 2-meter distance. We have to always keep that 2-meter distance between our own household and another household if we want to protect each other. So if ever we have an asymptomatic case or a person who is 48 hours before symptom development and therefore risk of transmitting the virus, we limit the amount of contacts within that household. That's what we want to do. So we ask that you have your visits only once a week and that you wear masks if you can when you're not eating, of course, that you try to sit at separate tables, that you keep a registry of who's been in your house, what day, their names and the time that they've been in your home, so that if we do need to contact trace, you're able to provide that information easily. Remember, if someone gets a positive result, We usually get results 24 to 48 hours after a test. So once we get a positive result, we often have to go back 5, sometimes 6 days of knowing your whereabouts in order to be sure to reach all the contacts and keep people isolated and avoid transmission of the virus. That's the only way we contain the virus, is by doing that contact tracing and knowing who's been in your home when, who you've been in contact with and when. So I've seen many people keep a registry, and it's really beautifully done, where they have the person's name, the date that they were more than 15 minutes with that person and within 2 meters, and then they have the time and all of the information, so that if we do have to call you, we can easily contact trace. So I wanted to remind you about those safety measures involved with the visits, because it will have an impact on what we're going to propose to you for the holiday time. So I would like to preface what I'm about to say about the holiday time with the following statement. We continue to follow what's happening in the community. We know we know how important the holiday time is for all of us, and we know how tired we're all tired. We are all we're done. We're all done with this pandemic. I know, because I feel the same way as all of you do. However, we're entering into a really scary time. If we look at what's happening around us, things are not improving presently, and so we have to find ways to have contacts, to express love, to be together in a way that's safe. So the task force is going to propose ways to possibly do that, but depending on what happens between now and the holiday time, we may have to make recommendations other than what we're presenting to you today. So we want to give you some advance notice so that you could start thinking about how you might organize yourselves during the holidays, because everybody is starting to make their plans, but we may caution you against these actual plans as we get closer. So I just want to make sure that that's clear, that we're presenting to you what we feel is safe for today if things stay stable between now and the holidays. So we're going to pull up another chart, which again I really thank communications for, because it's difficult to explain all of this information without visuals. What we want to first remind you about, and I know I've just said it, so it's kind of repetitive, but distance, hygiene, and masks. It's paramount. No matter what you choose to do over the holidays, we really urge you to keep that in mind. Secondly, what we urge is that when you do, and if you do gather with vulnerable people, so anybody over 70, anybody who's immunosuppressed, that you do so with the utmost of care, with all of these measures in place to make sure that you are protecting these individuals. You might feel perfectly fine, and yet you may transmit the virus to someone else. We all are in that situation right now. As much as we feel safe and healthy and well, we could at any time be transmitting of the virus to someone we love. And so we have to always keep distance, hygiene, and masks in order to stop ourselves from transmitting the virus. And because we're in a state of extreme caution right now, this is of utmost importance. So as you know, we presently are recommending for our mental health, for psychosocial well-being, that we can have 2 households meeting once a week. What we'd like to suggest over the holiday time is that we increase the amount of people that could be in our home within a day, but not at the same time. So if you look at this table, between the 24th and the 28th of December, what we're recommending is that you still maintain only 2 households visiting at a time. However, that you schedule twice in one day those visits. So I'm going to give you an example. So, for example, I'll use my parents and my in-laws as an example. On the 25th, for example, if that's when I celebrate with my family, I would have my in-laws over in the morning, let's say for breakfast, and I would have my parents over in the evening for dinner. So we would be 2 households at a time, but we wouldn't mix my parents and my in-laws all together for dinner, because that would be 3 different households. And that would be increasing our contacts to the point where we would have difficulty keeping our 2-meter distance. And again, that 2-meter distance is what's of most importance. Now, why did we pick from the 24th to the 28th? We don't have any scientific reason why those dates are important. There's nothing backing that up, except for the fact that we felt that those were the days that were the most, where most people would celebrate the holidays. And we know that by increasing the amount of people in our home in a day, we still are increasing risk. So again, these are personal decisions for each of you to make. And many people that I've spoken to have chosen to celebrate the holidays with their household only. And that, again, is perfectly acceptable. And they've organized already to have Zoom meetings where everyone is eating at the same time, or where one family member delivers food to other family members and then they meet through Zoom. So there are many different options that are available to you if you're not comfortable having people in your home, and that's okay. But our job at the task force is to try to provide some safety mitigation measures and some measures that allow you to gather in the safest way possible. So that's what we're trying to do by this plan. So again, we have 2 households meeting. You're seeing this on the screen. From December 24th to the 28th, we see that you can have 2 households together twice a day. And then from the 28th to the 4th, we recommend that you go back to 2 households again, as we are now. And the last thing that we wanted to present is what's in black there at the bottom of the paper. So what is this about? What are we trying to prove by this last box? So from what we know is that after the holidays, as much as we put safety measures in place, as much as we communicate, and as much as we all are doing our best to limit our contacts, we know that we will go through a period of increased contacts, both within the community and external to the community. And we do expect that the end of January is going to be especially difficult for number of cases, number of hospitalizations, possibly even increased deaths. And we felt that in order to minimize risk, in order for us to contain whatever the outcome might be of our gathering time over the holidays, what we're recommending is that we stop all gatherings, so all household visitations between January 5th and January 18th. So on good faith, we're really asking that for those 2 weeks, we do not have any other households in our home. We basically keep to ourselves, go to work, of course, if that's what we have to do, but we don't have any other households in our home. We're doing this so that we can get a handle on whatever the impacts might be of the gathering and of the holiday time. We can't predict. We don't really know what's going to happen, but this gives us a little bit of control so that if there are increased cases, we are not just continuing to perpetuate the problem and the transmission of the virus. We're actually working at containing as much as possible. So those 2 weeks are like a family time. So I want to go back to something Arnold said, because he mentioned we're trying to find a way to make Christmas a little bit more bearable. I just would like you to take the time to think about all of the things that have become really bearable and have actually become even better since COVID started, in terms of the relationships you've created, how you've created them, the new ways that you've learned to make contact with your loved ones. There are many how we've taken time for ourselves and rethink our lives and what's important, how we've prioritized those situations. So I think that we can use those elements to help during the holiday time, and remember that there are positives, even though this is extremely difficult, and I urge you to use those positives to, again, increase your enjoyment of the holidays. And we'll continue to keep you posted, to keep you up to date with respect to what's happening within the community. And again, I thank you for really respecting the measures, because you have been respecting the measures. Our 4 cases are 4 cases and not 20 cases or 30 or 40. And so people are safe, people are doing what they need to do, and I urge you to continue. Thank you.
And thank you very much, Lisa. We would also like to thank Jaime Dickson for joining us today, and of course Arnold Lazare at the top of the program. There's plenty there today to chew on, so we shall be back on Thursday with our next update. And as Lisa said, it's very difficult out there right now. If you look in places like Alberta, they were over 1,700 cases just the other day. Ontario has set new records. Quebec has settled down somewhat, but it's still over 1,000 every day. So yeah, things are difficult, but if we stay the course, you know, we could be okay, and so far so good. So take care, everyone. Don't forget, wash your hands, put on your mask, keep safe distance, and we'll see you next time. Yawakoa dano, wanagiwahi.